My name is Jennifer O'Donnell. I'm a nurse practitioner. I graduated from Boise State in December of 2018. I am a nurse practitioner at Laurelhurst, which is a post-acute care skilled nursing facility and an ICF facility. So I have kind of patients that I see as their primary care provider, but I also see some patients acutely who have just discharged from the hospital. I kind of had always envisioned myself either working in a place that I work in now, the post-acute care facility, or as a transition nurse, kind of nurse practitioner, keeping the patient out of the hospital. So once they discharge from the hospital, to kind of prevent them from going back. So I had always known I wanted to be an adult gero nurse practitioner and focus mostly primarily on patients with congestive heart failure and diabetes and kind of some of the big things, and kind of meet the patient where they're at. That was my big plan. So the adult gero program fit in perfectly for what I wanted to do. I actually got my bachelor's degree at Boise State, and I loved the bachelor's program. So it just was a really smooth transition for me to go from my bachelor's at Boise State to my master's at Boise State, and ended up even liking the master's program even more than the bachelor's program. So I basically kind of went straight through. But there's time gaps just from when you apply to when you get in. So by the time I started in the NP program, I had been a nurse for probably about 5 years. Boise State's program actually fit in really well with my current role, both the adult and the geriatric, mostly primary care, but also with a little bit more of a kind of an acute care role I took on, having a good solid foundation, the basic foundation. I think when you go to any nursing program, you don't learn everything you need to know. What you really need to know, or what you really learn, is what is the kind of the building blocks. And I think that Boise State did a great job of kind of giving me those building blocks so I could build upon or learn more even after I left school. So, I mean, really what got me through the program was my cohort, the people that were in my cohort having, and almost, I took advantage of almost everybody in my cohort. We were all a pretty close, tight-knit group, which really, really helped. And it's kind of focusing on, I was a med-surg nurse, but one of my classmates was a GI nurse. And so it's kind of starting early, knowing who to go to, and it was a team. Like I definitely think my education at Boise State was a team. I had incredible instructors. I mean, my instructors were so different from my RN program because they were so supportive. You can call them on the phone, you could email them, you could do anything like that. So I personally probably took advantage of that more than other students in the program, but I really like that. But the whole team approach is probably the most important thing. It's nice that it's a nice small cohort and you can kind of get to know each other, and you can kind of take from other people's strengths or use their strengths when it comes to nursing. Like I use the example of the GI nurse or the hospice nurse. I hadn't done a lot in hospice, and we had a hospice nurse in our group. So I think that was the best thing, or the biggest thing about kind of getting through. And we all have good days and we all have bad days. So when I was having a bad day, there was someone there that was having a good day, and they could, you could call them or you could talk to them, and it's like, okay, we can get through this, we can do this. And some days I was having a good day, so I could be the cheerleader. So I think that's the biggest, and the biggest thing for me getting through was the close-knit group that we had, or, with the whole cohort, but also specific other students too. Honestly, when I first started looking at programs, I'm like, oh my gosh, even the first year is super nerve-wracking because you don't know what to expect. And then you get there and you're like, even the simulations where you had to go in and have your own patients and they were videotaping you. Like the first time you did it, of course, I'm nervous anyways. I was really nervous, but after you did it and you had the support of the instructors and the other students, it ended up being really fun and you got to learn a lot. So I looked forward to it. The second year I was like, oh, this is gonna be great. The third year I was like, yeah, right now this is awesome. So, and every year seemed to get better and better. I know the program's hard. And I mean, and I know the program's hard, but also there's so many benefits, and not even just ending up being a nurse practitioner, but even with this degree, there's so many things you can do. You can teach, you can, so I just stick with it. It's worth it.